Welcome to Tame the Taboo. This podcast is brought to you by Discover Her Health. Discover Her Health specializes in healthcare, education, and resources for her most intimate concerns. I'm your host, Nurse Jenna Rae. I'm a women's health and gender-related nurse practitioner, and I am making it my business to take you from sufferer to sensei. So if you are suffering from conditions that are not easily treated in an annual exam, or you want to join me on this journey to become my healthiest, wealthiest, best business owning self, sit back, relax, and enjoy these episodes. Welcome to the podcast, Tame the Taboo. I am your host, Nurse Jenna Rae, and I am so excited to have Emily Sauer here. And we are going to just really get into pelvic pain and being a maker, being a visionary, being a mom, and how it all connects. So Emily is our very first guest on Tame the Taboo, and I am so excited to have her. Emily and I actually connected at a conference where she was a vendor. So she was showing off her wonderful product, the O-Nut, which is one of my faves. It's a buffer for women who have pelvic pain with deep penetration. And as some of you know, I am an expert in pelvic pain and women's sexual health. And so this is a product that I recommend to my clients all the time now. So I'm so excited to have you, Emily. Welcome to the pod.
Woohoo! Thank you. This is the first episode. We get to do whatever we want right now, which is great.
We get to just play. We get to just see.
That's the goal.
Yeah, in life and work and everything. So yeah, Tame the Taboo is really just a space for us to talk about the things that, you can't talk about at Thanksgiving dinner, but conversations that need to be had.
So we invite you to bring them up at Thanksgiving dinner if you feel so inclined after this podcast. You've got a couple months ahead of you to practice, so it'd be great.
Yeah, if you got a cool family, then bring it up. If not, then just join the pod and talk with us. So let's talk a little bit about you, Emily. Can you tell us about your journey and what led you to becoming a patient advocate in the pelvic health world?
Yeah, so I am first and foremost a patient founder. I started O-Nut, which is as you said, a product designed for individuals who have deep pain during penetration. And I made it because I needed it. Honestly, people ask me all the time, do I have a medical background? Do I have a product manufacturing, marketing? I don't have any background in any of these things, but the need was so strong, right? I had experience with pain during sex for my entire sexual existence. And I never mentioned it to a partner. In fact, the only time I ever mentioned it was annually at my GYN appointment. And I was literally just told nothing shows up on any of the reports or anything. So just, relax and try different positions. You'll be fine.
Sorry. I was just going to ask, do you think that since you brought it up in your annual exams and you weren't really met with someone who could help the pain, do you think that deterred you from talking to your partner about it?
Oh, absolutely. I mean, also, so I didn't talk to my partners. I talked very hesitantly to my GYN to ignore the complication. And then what I did was I tried to look up online, what causes pain during sex, my cervix is low. I don't know what's going on. And the response that I got online was horrifying. If I don't have a language to know what to look up, the responses are going to be all over the place. So because everything pointed to nothing, the only person I had to blame was myself.
Mm-hmm.
So every time I had sex, I was uncomfortable. Yeah. Sorry, what did you say?
I was just saying, so yeah, you blame yourself. What did I do wrong? Why am I broken? How can I fix me?
Yeah, how can I ignore this so that it's not a problem? Mm-hmm. That's what happened for me. I just kept ignoring it because I figured if I ignored it, then I wouldn't have to face it. But ultimately, I was in a relatively unhealthy relationship with a very lovely person. Sometimes that happens. And I just got I got into a darker and darker and darker place. And every time that sex was painful, it wasn't just a physical discomfort. I was just so disappointed in who I was as a person and as a partner. I consider myself confident and lively and open and honest, and everything about my sexual experience I made me become the opposite. I closed off, I shut down, I got really sad. until finally I just came up with this crazy idea that maybe if I could control how deep penetration went, then maybe I wouldn't feel so terrible about myself. And this like crazy vision of a donut around a penis was like the most lovely idea and conversation starter, honestly. Yes, you're holding up. I love looking at it. It's so fun. And so what I did was I went online and I bought like something that could function the same way. It was like a foam donut that had sprinkles and it smelled like vanilla. And I would not suggest using it for sex because it is not sterile or particularly comfortable for that matter. But ultimately it worked, right? And when it worked, I felt all of a sudden like the years of blame that I had placed on myself lifted. And it was no longer my fault. And all of a sudden I had a choice not to be in pain.
You also had the choice to not be a shell of a person. You had the choice to show up in the world as your full, authentic, true self.
Oh my God. And that authentic true self came out with flying colors because I literally talked to every single person that I knew and that I didn't know about pain during sex. I was like, oh my God, I've had pain for sex for years. And I came up with this crazy idea and it worked. And people would be like, whoa, 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 slow down. I have pain during sex too. Or like I've been with someone who had pain during sex and I didn't know what to do and it was horrible. Like all of a sudden, I felt, I mean, I like couldn't believe how common it was. Like I had felt alone for so long. Like I just assumed that no one could relate to my experience. And then all of a sudden it was like, oh, wait a minute. What's going on here?
It's so funny because you didn't stop at creating the O Nut, right? Like you took it a step further. You co-founded Lady Bits League. You co-founded Pain Perception Project and Pelvic Gym. Like you didn't just create a product. You created a world of support for women and really, gave the girlies what you needed. Tell us more about all of those projects.
Totally. It's like all of those things just came as they were needed, right? So when I started ONUT, I came up with this idea. I wanted to make sure that I wasn't just basing it on my own experience. So I launched this group with another person to talk about our sexual experiences that maybe made us uncomfortable or that we were curious about. And she wanted to make the first one about pain during sex. And we were writing up the email invite and she was like, let's talk about pain during sex. I was like, wait a minute, no one's going to come because this is a topic that no one wants to talk about. It's like really sad. It's really, down. And she was like, let's just try it. And ultimately we had like 40 people show up in my little New York apartment. I was like, wait a second. And, I think sex is presented to us in this orgasmic, pleasurable, like best sex ever, elusive idea that dictates all the other conversations we have around sex. And ultimately, it's so much more complicated than all of that like ephemeral, high-hitting adrenaline stuff. Like, yeah, I mean, obviously it is. But anyway, so the response that I got from creating the Lady Bits League was just to learn about other people's struggles and questions with their bodies and, kind of shaking up the normalization of what we think we know.
That's so interesting because I like to think that I talk about sex in a very unsexy way, right?
Yes.
I want to nerd out about it. I want to talk about, like, I want to give it the space that it deserves to really occupy all of human existence. It's not just about like the sex that is on TV and on commercials. Like that's not just what sex is. Like we have to give it space to really be what it is. It's the core of humanity. Everybody comes from some sort of like sexual experience. And if it's only talked about in this sexy way, then we miss everything else that it is. So
right. And then it's like, what is the everything else? I mean, I love that, like you talk about sex in an unsexy way. Because I think, historically the pendulum has swung like male pleasure, erections, blood flow, hard, wet, bleh, and then the pendulum in like this feminist moment has swung the other way. And it's like, okay, female arousal, wet, juicy, bleh, orgasm, multiple orgasms, measure your orgasm, blah, like I'm not into either of those things, to be totally honest, because the pendulum sits in the gosh darn middle where, we just want to feel like we're doing a good job, and we want to feel good about our bodies, and we want to feel confident and whole and seen. Like, where are the products that speak to that part of sex? And that is ultimately what drove every single company and organization and advocacy group that I've created.
That's awesome. Let's talk a little bit more about the pelvic pain perception project, because I
Yes.
think I remember a conversation that we had. So like tell me about it.
Okay, so check it out. Okay, so it's Nut. Product came first because I was like, gotta solve this penetration thing. And then Lady Bitsley came second because needed to figure out what was like the user, like the human experience of it. And then ultimately it was like, where are the doctors in this situation? Like, what is the missing dialogue that's happening? So how often do we find ourselves in a GYN office being confronted with questions like on the patient form when you go in, that are like, how many sexual partners do you have? What are your STIs? How many times have you been pregnant? Or it's like, and the response is to lie. Like, how often do we want to just lie? And why is that? Right? A quarter of OBGYNs self-report being disapproving of their patients' sexual habits. Patients also feel like they can't confide in their doctor because their doctor actually won't know how to help, which is actually pretty true. But for the Pain Perception Project, where a starting place that we felt would be helpful was creating this questionnaire that lives online where people can fill out, pelvic health history, period pain, regularity, any kind of pelvic pain, any kind of pain with sex. So it takes like a holistic pelvic history while also being inclusive of sexual health and quality of life goals. Oftentimes when we go into the OB, they don't really ask us about our desired outcomes, and they might just like offer a certain treatment or kind of push you out the door without really considering what it is you're trying to move towards. So by helping people identify what their actual experience is, like what is painful about sex? Is it pain at the entry, pain deep inside? How long does it last? When does it happen? Is it during sex? Is it after sex? Is it getting worse over time? A lot of these basic questions are never asked, so we don't even fully understand what's currently happening. So we ask these questions, and then it results in this like beautiful printout that you can take with you and then bring to your doctor as a way to help you self-advocate in a situation where you are your best advocate.
So we were at the conference. I think it was the Ishwish conference, and I remember having this conversation with you, and I was like, what I want is my clients to come in and know that it's a safe environment where we can talk about all of these things. And I remember being like, Emily, just give the people a quiz so that they can like already have it filled out, and you can start the conversation without that awkward silence, And so I was so proud to see that you guys launched that. And now that I'm out, doing my entrepreneurial thing, that was one of the first projects that I worked on too, was creating the Tame the Taboo quiz. So same kind of idea. You can go on, take the quiz, figure out how to put down on paper or electronically all the things that are bothering you, so that when you come to your provider, it's like you don't even have to ask me any questions. Here's a handout, like this is what I am going through, and let's maximize the 10-15 minutes that we have together. And if it's not you who can serve me, refer me to the person who can.
I love it. I mean, you bring up a really good point. It's like it's setting the foundation for having a certain level of confidence when you come into the appointment. And then also knowing as a patient or client coming into the office that if your provider can't help, then a referral is absolutely something that we can ask for. Absolutely. If your doctor can't help, it's not your fault. You did not do anything wrong. And there is a team out there that can help you. Who is my referral? I love that.
Giving people permission, and also giving providers permission to say, you don't have to have all the answers. I'm not expecting to fix me in 10 minutes. But what I do expect is for you to know your limitations and to have some sort of network to back you up.
Totally. Well, it's one of the things that I was very disillusioned by. It's like, we're taught to trust certain clinicians or certain physicians, and OBGYNs are generally taught childbirth, disease, and infection.
Mm-hmm.
Childbirth, disease, infection. So not pain, and particularly not sex. It's like a
Mm-hmm.
lot of these different clinician silos focus on different areas of the body, and then they don't talk to each other. So you're talking to one provider who has a very small understanding of a very specific thing, when your provider should be communicating to there are, again, that's why there's kind of a multidisciplinary team that's often the most helpful in figuring out how to treat and diagnose.
Definitely. I think that's why I call my skills unicorn skills. So I'm a women's health and gender related nurse practitioner. So I have the GYN, the OBGYN kind of background and training. And most people who are women's health MPs, they go directly into traditional OBGYN roles. But
Sure.
I'm, of course, a risk taker. And I was like, let's do urology. Okay, let's talk about like pee and bladder things. And so I
And
was
yeah.
positioned in a world where they were very much siloed. Like the urologists were like, if you have a vagina, I do not care. Do not tell me about it. I don't want to look at it. Like I will go to the urethra and bypass everything else in the pelvic floor, you know? And so I was very
Mhm.
uniquely positioned to merge the worlds between OBGYN and bladder dysfunction. And of course, sexual dysfunction is going to become a part of that because
Mm.
it's still in the pelvis, right? And so I'm very, very blessed to be a clinician and be able to, like you said, not work in silos and kind of have
Mm.
all of these unique skills working together to deliver the best care possible.
What I
And we
just
need
learned recently is that urologists are like the owners of the clitoris, because the clitoris is more like the penis than anything else. So urologists are the most apt to actually treat clitoral complications.
And it's only about 3 urologists who care, and they are all mostly female urologists.
Yeah.
um, but yeah, the clitoris is also missed. People are like, because OBGYNs are definitely not interested in that.
Mm.
And, traditional male urologists are like, no, 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 I don't want to do that. So yeah, it's definitely room for another discipline. And that discipline needs to just be overall pelvic health, and that's what I'm
Right.
really trying to champion in the work that I'm doing is like there we have to take ownership over the clitoris, over the vagina, over the bladder. Pee, poop, sex, breathing, it's all connected and
Hmm.
somebody has to take care of it all. So here
Yeah.
we are.
Amazing. Amazing. Yeah. It's yeah. We're in a good moment right now.
Yes, yes. All right. So you're an entrepreneur, you're a maker, you like to build things. Like tell me specifically, besides your own personal experience, like what about the pelvic health community really kind of got you like fired up? Like, yes, you experienced pelvic pain yourself, but was it something else? Was it the fact that other women were also suffering in the same way, or what's so
Oh
special
God.
about the pelvic health community?
Oh well, honestly, I felt like what's it called when you discover things? A detective. When I created Ona, I felt so much like a detective. Because again, like I was like, painful sex, and like my cervix is being bruised, or I don't know, whatever. And everyone had no idea. Like I talked to a ton of people who were experiencing pain during sex, and they had no idea what was going on. It was like, why did none of us have any idea? Why are none of our doctors helping? And like, what can we actually do to to stop this pattern and create a paradigm shift around empowerment and education? So I mean, I started going to as like a nobody. I started going to medical conferences as an attendee. I didn't even go with like a table or anything. I literally showed up at ISWISH for the first time in 2019,
Mm-hmm.
and I knew that the top 5 people on the board that I should talk to, and I showed up with my little prototype rings that I made in my kitchen that looked beautiful,
Mm-hmm.
and I started to learn, and I attended all of the seminars. I was learning things that I felt like I should have known, that I feel like everyone should know.
Mm-hmm.
Like diagnoses take, 8 to 10 years, but at the same time, it should not cause delays in treatment. What
Mm-hmm.
are the symptoms? Like, what are the psychological cycles that are happening? What is the biopsychosocial model of care? We sexual health is just launched into this, like pelvic health for women has been narrowed down into having a sexually appealing vagina. That's what
Mm-hmm.
most of us think. Like, pelvic health is a sexually appealing vagina. And all of a sudden, yeah, I think what became so interesting about this space is the vast amount of very interesting education that all of us can have.
And are entitled to, that we should
No,
have.
yeah, for sure. Yeah,
Yeah. One of the things
absolutely.
I love about being able to be out on my own and practice in the way that I practice at Discover Health is that I spend an hour with every client. And
Mm,
so you're not going to leave your first visit with me without seeing your clitoris, without seeing your vulva, without understanding that your vagina is not your vulva. And I just want that for every single woman. And I just feel like
mm,
being able to empower women to truly understand themselves, you get
yeah.
outside of being that shell of a person. And I really feel like we are creating the change makers because we're like, okay, now go off and show up as yourself, be authentic, light the world on fire.
And it's true. I think part of the hard part, I mean, when you said you're like, no one leaves my office without knowing their clitoris and knowing that, I'm just like, woo, that sounds scary. I'm like, all of a sudden there's a part of me that was like, do I want that? And thinking backwards, like how does someone prepare or feel confident in coming to you and doing those things with you? Like, how do you make that comfortable in an appointment? Or how do you make someone comfortable to do that outside of an appointment?
Yeah, for me, it's normalized, right? So because everybody does it, I don't really care that you're scared, right? Of course, you have to give active consent. And if you don't want to do it, then you don't want to do it. But it's not a big deal. It's not something that I'm doing for the first time that day with you, you know? So it's just
Mm-hmm.
like another vulva that we're looking together with.
Mm,
It really feels like me allowing you to open up that closet and look in and see that the boogeyman isn't there. This
mhm,
isn't so scary. When we can take a look and fully understand your anatomy and teach you what's normal, we can figure out what's going on with you. And people are more
mm,
appreciative of saying, like, okay, now I can see how red things are down there. I'm not crazy. I'm not
mhm,
making it up. It's not in my
mhm,
head. Wine will not help this. So,
mhm,
women, I've had a couple clients over the years that are like, absolutely not. I'm not looking in the mirror. Like, there's nothing you can say to make me change my
mm,
mind. But for the most part, people are super appreciative and they're on board because, again, it's not like I am saying, like, if you want to do this, it's no, here's a mirror. This is a part
mm,
of my exam, and if
mhm.
you decline, then you decline, but this is how I do things here. So if you're on
Right.
board, let's go ahead and do it.
I love it. I love it. Man, and there's nothing like ripping the band-aid off too. You just you're like, if you, I don't know if you've ever been like bungee jumping or skydiving, you're like, oh, I don't want to go. I don't want to go. You're like, you make a million reasons not to go to the appointment, not to make the appointment, not to look for that thing online, not to blah, blah, blah. But it's cool that like someone can rest assured that when they come to you, like you're gonna be with them, you're gonna just make it feel so casual.
Yep.
Mm.
Yep. Sex in an unsexy way. It's
I
it's
love
not
it. I love it.
big hype thing. Yeah. And guess
Mm.
what? I'm going to show them the O nut, right? Like I
Mhm.
have my dilator out, the O nut's on there, and I'm like, hey, if you feel pain with that deep penetration, here's something that you can start using today. Because we sell it in the
Mhm.
office, right? Take this home with you and see if this helps. And once people start to feel better, like, okay, that helped a little bit, they're invested. They're like, okay, I want more of that. Okay, I feel
Mhm.
50% better, 80% better. Like, help me get to 100%. And then we rock. Then we rock out.
I love it. I love it.
Yeah.
Yeah. It's really cool also because I think everyone going back to your question about what makes the space so awesome is like everyone kind of comes at it from a slightly different perspective. I think from like whereas you're just like really even keeled and you're like the smartest person in the room that can make everything feel like it's manageable. I think for me and the way that I've approached Ona is that like what resource would I have given my past self when I
Mm-hmm.
was super down? Like what are
Mm-hmm.
what are the words that I want to hear? What is the way that I want to feel? And so I actually created a lot of the brand messaging and the packaging as if to speak to my past self. And actually, in our box, whenever you get an Onut, there's a letter that I wrote that's in the box.
Mm-hmm.
And if it's okay, I'd love to read it. Yeah. It
Yeah, of
says,
course.
"You made it. A big congratulations not only on your new Onut, but also on all the hard work that led you here. The journey is never easy. I tell you with my full heart, you are sexy exactly the way you are. You are a problem solver, a shoulder to lean on, a spreader of joy. You put a lot of love out there, and you deserve to live that love you share. So, in the spirit of curiosity, embrace adjustment, awkward moments, and small, mighty victories. And know deep down, but not too deep, that you're doing great. Now go play. All of my love, Emily."
I literally have chills. That's so beautiful.
I just think that it's so hard to, again, to like not blame ourselves and to feel a sense of I just think everyone could feel a sense of validation with whatever we're dealing with, whether it be painful sex, whether it be just body insecurity, whether it be, whatever is in the way, relationship hangups, or like religious beliefs or family, there's all kinds of things that could kind of get in the way and cause a physiological response. But the first step to untangling that is just feeling, is just feeling, honestly.
Mm. I just had this thought that you right now in this moment, right? Like your best self showing up as Emily, the power sour person that you are. You were guiding that Emily in the past. You
Mm,
were looking in the past to your best self to say, how do I get there? And I just want to congratulate you for showing up as yourself in this moment and really like realizing the potential that you had, and also for making room for so many other women to show up as their best selves too.
mm, I appreciate that. I appreciate that. I think also, like, when it comes to moving forward and seeking help and trying products and all that stuff, there's always this expectation that like things will fix immediately. Like, this is an immediate fix. I want this to fix. Like, the path is oftentimes not a straight line, and to it's really important to leave space for the dips, the regressions, the doubt, because I think it's just a natural part of being human, right? It's like, I didn't speak up about painful sex for over 10 years. Like, I'm not going to shout it from the rooftops during sex nowadays just because I created a product. Like, that's a really hard habit to break.
Mm-hmm.
But but what I've done, it's like, so how do we work with these parts of ourselves that need a little bit of love? And for me, in this example, I've talked to my partner about it. Like, it's really, really hard to talk to partners about painful sex. I mean, it may be one of the hardest parts is to talk to your partner about what's going on. But the truth is, it's like, it's exhausting
Mm-hmm.
not to talk about it.
Mm-hmm.
And ultimately, can you
Carry it on
imagine
alone.
you carry it alone? And imagine if you were in a sexual experience and your partner was like in pain or uncomfortable and you had no idea.
Mm-hmm.
Like how does that feel as the other person in the equation? Like, you're completely powerless. There's nothing you can do even if you want to help. And there's no way to like reconnect in any way outside of the bedroom either. So it's like, partners really want to know. And if they don't want to know, screw them. Move on. They don't deserve you at all. And if it
Exactly.
doesn't come, like, listen, if they're not going to hang out for this kind of stuff, you don't want them around long term, anyways, right?
Mm-hmm.
Like, we deserve so much better than some whoever who just needs to have their orgasm checkbox ticked off whenever they want it. Like, screw that person, seriously.
Mm-hmm. Mm-hmm. Definitely.
Sorry, I get really fired up about that kind of
That's good.
stuff.
I love the fire. I feel like the fire is what attracts me to you as like a friend. Like I met you and I immediately was like, that's my girl. Like me and Emily, we're tight. And so seriously, when I launched the practice Discover Health, healthcare education and resources are the her in Discover Health. And the resources, I knew I wanted to shop because I knew that life-changing products like ONUT, I needed to be able to extend that to my clients. And so I remember when I made the crazy decision, I launched my practice in 6 weeks, like had a baby
Woo!
and
Get it.
okay, now we're doing it, And I remember sending an email to you and saying, Emily, like, now I'm ready. I'm ready. Like, how can I get my hands on some O-nuts? Because I need to extend this to my clients. And, that fire that you have inside of you, it just made an impression on me. And yeah, from day one, I was like, yep, when I start my practice, when I start my shop, that will be the first product. And now when I start my podcast, that will be the first guest. So I'm just
Yes.
delighted to have you today.
Well, and like every single person, every one of us has that fire, right? It's there. It's there. So it's like, what lights that up, right? And how can we just turn up the dial on that fire? Granted, I don't want to be like energized and like pissed or like all the time, but it's really cool. it's like the thing that moves the needle for each of us as people. So it's like, who are the people in our lives? What are the, I hate to say it, like, what are the products? What are the things that hear us, that really, really let us be our full selves so that we can rise and make the choices that we want to make?
I love that. I love that. My last question for you today is going to be about motherhood, right? So for me, it's motherhood set me on fire, right? I already had the fire inside of me, but like having my baby was just like, it's now or never. How has being a mother impacted that fire inside of you?
Oh, I'm going to take a second to think about this because I don't have an answer. Okay. Being a mother has, well, first of all, it's taken up a lot of my time. So what's left is much less time that's forced to be significantly more focused. And in having that constraint, I have to be much more intentional about what I do with my time. And right now we're in a place with ONUT where, we started this company as like a really story driven, vulnerability driven, and then we're like, okay, we have to sell a product. So it got like kind of more and more like salesy and product focused. And we're actually coming back to a place where we're realizing how important that story is. And I think as a mother, I'm really enjoying noticing these like beautiful details of interaction and nuance. And he doesn't. He's like 14 months, so he doesn't really speak yet. And so, and also, I'm like paying attention to these like beautiful nuanced details with him, and also looking back at all of the phases that have come and gone during pregnancy and newborn stage, and the body recovery and the mental exhaustion and the partner recovery. Really identifying life as a series of phases. And sometimes things need to take a pause. And sometimes things have their time to thrive. And from this vantage point in motherhood, it's just knowing that all of these things are going to come. And when there's an off moment, that's okay. And when there's an on moment, jump on that train.
Ride that wave. I love that. We have to end it there. This has been. I know we gotta bring the people have short attention spans. Okay, I know this is a great conversation, but I'm like, dang. Okay, we have to have a part two. This will not be the last of Jenna and Emily. I adore you. I'm so proud of the work that you do, and happy Mother's Day. And we'll have to have you back on the episode for sure.
Yeah, I mean, we have a new product coming out at the end of the. I'm like, quick pitch. New product coming out at the end of the year for folks who have entry pain. So ONUT is becoming the destination for folks who have pain during sex, regardless of what kind it is, for resources, communication, and products themselves. So we're really excited to be kicking off there.
Where can the people find you?
Just Google ONUT. Don't worry about the www. Just OHNUT. If you spell it wrong, that's fine. You can look up penis donut. That's fine too. But also not explicit to hetero relationships. ONUT can be used by on any partner for lots of holes. Oh my god. Okay, I just said that anyway. Oh, also Instagram and TikTok. At ONUT Co. on Instagram and TikTok. OHNUTCO.
Awesome. Well, Emily, it has truly been a pleasure. I think that you've given so much value today, and hopefully this lights some fire under people. Thank you so much for helping me to tame the taboo. And this is
Woo!
just getting people.
I love it. We got to run with that taboo and shake it
Here we
out.
go.
I love it.
All
Thank you
right.
so much.
You're so welcome. Thank you for tuning in to this episode of Tame the Taboo. If you enjoyed it, don't forget to hit like, share, and subscribe. Send this to your girlfriends so they can join you on your journey as we transition to our healthiest, wealthiest, best selves. See you on the next episode.